Hello, everybody. How are you all doing today?
Good. Hi,
Good.
everybody.
I know that Nadia just came back from a full day of work, of her second day working at a community health center. I know that you're a little bit tired.
Yeah, I'm still getting used with the whole work schedule, but it's been a lot of fun.
Yeah. And we have Dr. Nichole Tyson with us today. And did you see patients today?
No, today was just doing some teaching and some catching up on, like we were talking about before, the post holiday slew of emails and messages. And we'll do that after the new year. And now it's the new year.
Yeah, it's a little bit overwhelming. It's a little overwhelming. I have to remember next year to pre-anticipate how difficult this part of the year is so that I don't overschedule myself. Um, Dr. Tyson, Nadia is working at a community health center in
Mhm.
Boston. Before you were a physician, did you do work like that as well? Like work as like front desk or an assistant or a scribe?
Yeah, that's funny. I went to medical school in Boston, so I actually did a lot of fun community
Okay.
things in Boston. I think one of my favorite things I did was started a fun run for raising money for breast cancer
Oh,
in the
wow.
In Boston Commons.
Oh my
So
goodness,
it
that's
was
so
really
sweet.
fun. And yeah, it was, you know, we tried to optimize the climate, which is always a challenge because you don't know what you're going to get at what time of year.
Yeah,
Hot
yeah,
and humid, or you're going to have snow and rain. And that was some
totally.
of our biggest challenges in coming from California.
Yeah.
I didn't even know what people were talking about until I lived there a little while. Then you know, right? It's
Yeah,
cold
yeah,
and
very
muggy.
cold.
But yeah, gosh, it's like trying to think back of what I did. I worked mostly, I think, before I went to medical school, I was kind of a lab rat. I did a lot of lab work, and I really thought maybe I was going to do a PhD in research.
Oh, cool.
So then I realized how much I really like working with patients and teenagers, and that maybe
Yeah.
cutting up brains and taking pictures in the lab and looking under microscopes wasn't my dream journey of life.
Well, let me introduce a little bit about you, Dr. Tyson, so that our listeners know who they are listening to. This is Dr. Nichole Tyson, a clinical professor of obstetrics and gynecology at Stanford University School of Medicine. She specializes in pediatric and adolescent gynecology. And for over 20 years, Dr. Tyson has partnered with girls and their families as they journey from childhood through adolescence and into adulthood. And she enjoys solving complex problems as well as common concerns that can be overlooked and challenging to girls and young women. She's been recognized locally, nationally, and internationally as a leader in the field and as an experienced surgeon. She's consulted as an adolescent gynecology expert for online articles in magazines like 17 and Self and New York Times. And she is the chief of pediatric and adolescent gynecology at Stanford Children's Hospital and the director of mentorship and coaching for the OB-GYN department. She is currently working as a chief editor for two pediatric adolescent gynecology books, both due for publication this year. Congratulations on that. It's not
Thank
easy to write a
Wow.
book. You got two coming in.
I would say it's different being an editor too. So it's a big project, but also really cool project to have these projects in the spaces in which I work. It's really fun.
I can imagine. Well, thank you so much again for coming and talking on our podcast today. My first question is just regarding my own, not having knowledge on pediatric and adolescent gynecology. So I wanted to ask if you could tell us a little bit about how you decided to become a medical doctor that specializes in this area.
That is a great question. And I will tell you, if you're, Nadia, thinking about this journey of medicine, there's a lot of twists and turns in the
Yeah,
journey. And so sometimes we go in with one thing and we come out with a completely different spin. I
totally.
watched that in my own daughter, who's graduating medical school herself this year. And that was certainly
Oh,
my
wow.
experience. I always thought I was going to be a pediatrician, to be honest. So I kind of studied psychology and biology. And like I
Hmm.
had mentioned, I sort of did a lot of lab work and some volunteer work, but honestly worked sort of as a nanny through college. So I felt like I had a lot of, kid exposure and kid time. And then went to medical school sort of pursuing that. And for, various reasons, we kind of get influenced about what we want to be when we grow up by the people that we work with and maybe the people that we take care of.
Mm-hmm.
And I ended up doing a lot of pediatrics in sort of high intensity spaces like the ICU and the emergency room.
Wow.
And then on this very chronic, yucky illness ward. I say yucky because it was just really sad. So I saw a lot of loss and grief and tragedy, and I was pretty miserable. And I just thought, this is not what I thought, being a pediatrician would look like. And for many people, it's not. It just was my experience on those rotations. So then I kind of reached out to other places to work, and there was this really cool collaborative team of different specialists. So like reproductive endocrinologists and infertility, they were OBGYNs, and then other OBGYNs, and this doctor who was an adolescent specialist. And it was basically this amazing collaboration of doctors seeing really cool teenagers with all these different problems and interesting things going on. And so I just loved, like, they didn't wear a lab coat and how they talked to their patients, and they sat down and had really quick, diving into the juicy stuff of life, relationships. And it was incredibly refreshing. And I sort of had that aha, like, this is where I belong. Like, this is a space I love. And so it combined that idea of getting to do surgery and getting to the OB part, which I loved, and taking care of women and children. And then just having some really great interactions with adolescents, which I absolutely loved. And it was the best pivot I made. So I'm sort of thankful to those horrible rotations that I thought I didn't even know if I wanted to be a doctor anymore, to be able to find something that I truly love. And I still do this many years later.
Yeah. I feel like it's refreshing for, people like me who are still in college and thinking about medical school or even in medical school, because I feel like I get a little bit scared sometimes that, the thing that I'm going to set out to do in medical school and my end goal is going to change, but, those things will happen for a reason.
They definitely will. And they probably will in your career too. We have long careers, and there are lots of different possibilities in those careers too, which is kind of fun to think about.
Yeah.
So you don't want to get too wedded to something, but then you also, want to love what you do and be able to stick in that space for as long as you can.
Yeah, there is a lot to learn about when you have a bad experience. I went into physical therapy school assuming I was going to do outpatient orthopedics. And then I was in a lecture for pediatrics, and I saw that the pediatric clinics looked a lot like a gymnastics gym. And I was a gymnast. I was like, oh, I would feel really comfortable in that atmosphere. So I went, and then one of my clinical affiliations was at a clinic where it just happened to be a somewhat toxic environment, and the women that were working with each other were all talking badly about each other to me. It had nothing to do with the work itself, just like it just put a bad taste in my mouth. And then so in the end, I didn't end up pursuing that kind of work, but I worked outpatient ortho and realized how much I liked working with teenagers, specifically who are gymnasts and dancers. And so then I started my practice that was working with kids, but not in a developmental way. And yes, in a developmental way, but not with children that necessarily have gross motor delay, but sports injuries in young people. And then I work with the kids with gross motor delay in a more recreational way, like, teaching a fun gymnastics class. And I feel like that's a nice balance, but I don't know. I feel like kind of grateful that I got exposed to a bad experience, because it led me to a place that I really like being in right now. So, yeah, stuff to learn from the good stuff and bad stuff. I was wondering, when I was talking with some friends about who we were going to have on the podcast today, they were surprised that there was such a thing as a pediatric and adolescent gynecologist. And so if you could just share with us, what are some of the top reasons families seek your care?
Yeah. And I know, it's a funny thing because we've actually been around for a really long time now. There's actually, I 19 to 20, depending which year, fellowships that work in this space. So it's where OBGYNs who then do specialty care for taking care of kids and teenagers and young adults for all sorts of things. So some of the common things we see are like young children who maybe have vulva or vaginal concerns, or we see a lot of girls with bleeding and period problems. So from heavy periods, irregular periods, painful periods. We do a lot of kind of basic adolescent, counseling in those spaces and optimizing birth control for certain patients and teens. So we do a lot of bread and butter teen stuff, some like from acne to contraception to patients who have medical illnesses that are sort of outside of the realm of an OBGYN or a pediatrician. And then we do a lot of very cool surgical things, which involve how girls and people that develop a little differently embryologically. So they may have variations in their uteruses. So sometimes blood doesn't come out in the way that it should. And we see a lot of masses, so ovarian masses or pelvic masses. Sometimes ovaries will twist. So we have these fun little emergencies a lot. Injury, like another one is we see a lot of girls who kind of injure down there. We call them straddle injuries. As a gymnast, that's not an uncommon thing. So sadly, we take care of those kind of emergencies too. And I think we kind of overlap in a lot of specialties in OBGYN. So we take care of girls who are pregnant. Sometimes we don't have that opportunity as much where I work now, but that was always my practice prior to coming to Stanford. We do a lot of complex family planning, so contraception, sort of thinking about family building, and then we overlap a lot with pediatrics. So we take care of girls, who's maybe that aren't having their periods or having puberty problems. We do a ton of things with gender care, so taking care of kids with, managing their identity with sexually and with their gender. We do a lot of, I don't know if you've heard of polycystic ovarian syndrome. So that's another space with a lot of times comes to us with the regular period part. And the fun part is we collaborate with a lot of different specialties and a lot of different people to take care of kind of problems. And, so we even see kids who have maybe anatomic problems before they're even born. So they see these on ultrasound now. And then we're like, oh, well, this is a different uterus. And we try to manage things before problems ensue. And then we take care of girls into their 20s. I even have a young 30-year-old with developmental delay. And so we kind of try to optimize, their medical condition in the framework of sort of where they are emotionally and mentally, and do a little bit of TLC that maybe an adult gynecology practice is not as familiar or equipped to do. So there's some really fun spaces. Like I got to work last year with this very cool engineer who developed a tampon inserter for girls who have disabilities. Oh, wow. So, it's just like this very cool space that really looks at girls in all their different spaces. And it's very fun. It's great. And we develop these beautiful, fun, great relationships with patients and their families that, it's kind of unbeatable, I'll tell you.
Yeah.
That's really nice to hear. Yeah. I just imagine, as you were speaking, I was thinking about a young girl going to a gynecologist for the first time and wondering, how do you help them feel comfortable? But just by the way that you speak about it, it sounds like you really enjoy it. It must, your positive energy must emanate out to them and make them feel comfortable.
Well, it's very circular, I'll tell you. I think, there can be high anxiety, right, coming to a gynecologist. Even, I didn't want to go to the dentist today. I had a dentist appointment. I don't want to go sit in that chair and be scraped, and I'm uncomfortable and I have 30 things to do and it hurts sometimes, right? So that's like that energy you bring with you to the doctor. And so, going to the gynecologist is the last thing you want is to dread that. And people, have histories, they have traumas, they have experiences, they've heard these horror stories. It's like having a baby. Everybody's got to share their horror story with other moms. It's like such a bad policy. So, we have work to do to kind of do what's normal and healthy and happy and not make it a dread. And so it's a lot of my moms will take their kids out to go get boba after the gynecology visit. So it's good to be in a town with good boba. They're like, we're going to do that today.
So you said a little bit that you work with some patients that have problems with their period and stuff. And this question is inspired by a conversation that I had with my mom on our podcast in September. And I started my period when I was 11. And even though I've had it, for the past 9 years, I'm still pretty unfamiliar with, just the basics of a period, like the stages and all of that. And I was wondering if you could give us those basics of the menstrual cycle and how different stages relate to an increased or decreased likelihood of unprotected male female penetrative intercourse of getting pregnant.
Yeah, I mean, so I think part of it is you're speaking to, early on when we have our menstrual cycles, we see a lot of irregularity and variability.
Mm-hmm.
But usually, like after a couple years, we start to see those cycles kind of come after, coming more regularly, like more like every month. And so when we don't expect periods to be outside of like every 3 months, even when you first start periods. So there are some guidelines and parameters we use to talk to people about expectations.
Okay.
We don't like to see people use, more than 8 tampons or pads in a day, or soaking through their clothes, or missing
Mm-hmm.
school and activities because of pain or bleeding, or seeing things like anemia. So I think the tendency in America for sure is to put up with it. Like, well, this is
Mm-hmm.
something we have to deal with, and my mom dealt with it, and it's not that bad.
Yeah.
And so my experience and what the studies tell us is that we underestimate the impact of our menstrual cycles on our lives and the detrimental impact.
Mm-hmm.
So actually diving into someone's like menstrual history really helps us understand what their experience is like, and what we can do to either educate or help optimize or reaffirm. And a lot of times we diagnose things much earlier than they normally are. So we diagnose things like bleeding disorders, which are really, really common, but often
Mm-hmm.
aren't diagnosed. And that can be problematic for later life, from car accidents to childbirth to acute events. So it's good to know what's going on early. And same thing goes like with endometriosis. The average delay in diagnosis is about 10 years.
Oh my
And that's a
gosh.
lot
Oh,
of
wow.
misery and agony and sadness. And so we like to have those conversations early and find out where people fall into what it looks like for their periods. And then just sometimes simply educating about, it's a good idea to track your periods,
Mm-hmm.
because then we know, is this a pattern? Is this new? What does it look like? So just a lot of times we don't really pay attention to those details, but it is good to pay attention, because if something's changing or becomes abnormal, then we have sort of a track. And
Mm-hmm.
so getting to understand your body is probably the most important thing. So that is why, our national organizations advise having a visit with a pediatric and adolescent gynecologist or an OBGYN,
Mm-hmm.
or at least a trusted pediatrician between 13 and 15, age 13 and 15, to talk about a lot of those things.
Yeah.
I think it's important to mention here too that I think the first time you see an OBGYN as a young woman, you might not necessarily have an internal exam. Like you won't necessarily have.
You don't have an internal exam. Yeah, we don't really, there's no internal exams, because you don't need a pap smear now until you're 21, and probably,
Mm-hmm.
some cases later. And I think for many people, we're going to be able to just do your own pap smear, like self collect. And it kind of, that big speculum clamp issue is going to be kind of an olden days thing.
Oh,
Oh,
wow.
wow.
And we're going to see big impacts of this HPV vaccine that everybody got when they were young. And
Mm-hmm.
hopefully we'll be like Australia and get rid of cervical cancer altogether. So, they've been doing HPV vaccines mandated for school for a long time, 12 years now, I think. And
Mm-hmm.
they're just not seeing cervical cancer or cervical dysplasia anymore.
Oh, my
Oh,
So
goodness.
it's a humongous asset to women. But we're not there yet. We haven't got like
Mm-hmm.
the boys and girls vaccinated enough to see us not need pap smears. But I think that the time will catch up with us. So I think our future looks bright for that.
Can
nice.
you
And what
explain
about
a little bit? Oh, sorry.
were you going to continue with that question, Nadia,
Yeah,
about
I was
the
just gonna ask if she could explain a little bit about the um,
The self
self,
pap.
yeah, the self
Yeah.
pap.
So the self pap is really just using a Q-tip to collect the cells that but when we do a pap smear, we are looking at the cervix and we collect cells from inside the cervix. But now there's pretty sensitive testing that you can do that from your vagina.
Oh, wow.
So it's sort of like chlamydia testing. It used to be you had to go up in there to the cervix and hold a swab for 60 seconds. And even when I was a medical student, we used to have to, sorry, listeners, stick a swab into a guy's penis for chlamydia screening. It was devastating, like the poor guys. So then came urine collection, which is obviously not a lot less torturous. And you can now do self-swabbing. There's kits in the grocery store for your own screening of chlamydia. So that's kind of like, this is something that should have been done 15 years ago.
Yeah.
But with women's health, things come really slowly and funding isn't rich. But I think that's going to be what the future looks like. And there's already many, many programs and protocols being developed for that space, which I think is a really wonderful thing. It's not so great maybe for the business plan of OBGYNs, but I think it's great for women's lives.
That's very cool. I wanted to learn more because one of our old podcast episodes too, maybe the same one I was talking about before, we talked a little bit about a pap smear and just like, the anxiety that comes with that, and just the unfamiliarity with it, and how people don't want to go in just because they fear getting that pap smear, although it is very important. But yeah, that's very cool.
Yeah.
And then what about the cycle and when you're likely to get pregnant?
Oh yeah.
Our conversation was a little bit about how the college students manage preventing pregnancy. And we talked about how in some situations, Nadia's heard people the men not wanting to use a condom.
Ugh, I know, these boys. Yeah. Well, I say no condom, no sex. That's my motto, but they have to be responsible too. I mean, in all honesty, we really can get pregnant almost at all the different times because things happen. I mean, we're sort of designed to make babies. I think when you think about this sort of natural family planning where you have a very reliable menstrual cycle. So we know this a lot from fertility practices, right? So day one of your period would be, your day one of your cycle. And most of us ovulate on day 14, so 2 weeks in. But now you can really ovulate between day 11 and day 17. So fertility docs are like, have a lot of sex around those days. And then the idea is, then you would ovulate, get pregnant with their sperm around, and then be pregnant in that next 2 weeks. And if you don't, then your hormones now drop and progesterone goes up and you have your period. So a lot of people will do these they'll measure their ovulation at day 14, or they will really have very regular cycles and sort of calculate when not to have sex in their menstrual cycle. The problem is that young people don't have that reliable of menstrual cycles, or not necessarily tracking as well. The younger we are, the more fertile we tend to be in most cases. So a lot of times those methods aren't really advocated for adolescents for those reasons. I think it's really hard to count on that. The other thing is that they certainly don't help protect against chlamydia, which is really the most common STD in young women under 25. In some populations is as high as 1 in 7. Now we've seen some chlamydia, getting better and going down because I think people are using condoms and maybe starting sex a little later. But chlamydia is one of those bummer infections. I say bummer because 75% of the time you don't even know you have it, and it's working away in there to cause problems with your fallopian tubes. And that can cause problems getting pregnant later or put you at increased risk for an ectopic pregnancy. So if anyone who's sexually active under 25, we just do chlamydia testing every year just to check in, or whenever someone wants, changing partners. But it's not like, oh, you're a horrible person and you're dirty because you have chlamydia. It means you're under 25, and 25-year-olds and under tend to have sex with each other. And a lot of girls just don't get symptoms from it, which is a bothersome issue. Now you can have symptoms. You can have some pain and bleeding and burning. But most of the people don't. So the earlier you treat it, the better. The fewer infections you get, the better. And condoms prevent it. So, and a lot of people think you can't get an infection or you can't get pregnant the first time.
Right.
which makes no sense because, of course, again, I can't tell you how many girls have been pregnant the first time they have sex or get things like herpes, right? Like that is the unfortunate infection that keeps giving. So you have sex one time with one guy and now you get herpes, but you get these outbreaks forever and they're very painful. And so condoms are sort of, the essential thing that both of you guys have to be committed to.
Right.
And sort of develop. I think one of the things that I've worked with a lot of teens to help evolve is like developing the language to use a condom, which is, but I don't want to he doesn't want to use a condom, he says to you, because it's not as sensitive. I don't feel it as well. I'd rather not. And then you have this conversation, whether you're on birth control or not, that, well, I'm not really ready to start a family. And I want to keep my one body I have for my whole life safe. And so I want to use a condom. And if you don't, then you don't do that, right? There's a lot of other ways to have fun and have pleasure. But in terms of like penis and vagina sex, insertional, whatever we want to call it, then the condom has to be agreed upon. And that has to be part of the conversation. Sex is something mature people do. And so if that mature conversation can't happen, then it might be not worth doing it.
Right.
And I think that is where it's tricky. But girls should always have that voice and be able to say that and feel good and strong about that. And it's hard. I think it's a really awkward conversation. And most of the time we know that girls want to please the boys and they feel like, I know he really wants to. And so there's that pressure feeling.
Well, it's a good filter. Am I mature enough to have the conversation? Is he mature enough to have the conversation with me? If the answer is no, then that's probably a good filter out.
Yes.
Yeah. And it's, it's easy to say now, but you're not in the heat of the moment and you really like him and it does feel really good. And so there's a lot of compromising and negotiating on the fly, and that makes it harder. So it's a little bit more wise if you're able to have a plan ahead of time. It takes a little spontaneity out of it, but it takes all that kind of other risk. And then the aftermath, you always think about, how I'm going to feel afterwards. And that's another kind of way to think about it. And you want to feel good and safe and happy and proud versus anxious and nervous. And, oh my God, the pregnancy test and the morning after pill. And, oh, now I got to go get screened and all that stuff, right? Like it's just, there's a lot that goes into it.
And even harder when there's some intoxication involved.
Well, that is also true. And so, college is a big place for risks. So one of my college spiels has long been, it's not realistic to say don't do anything, don't take any risks, because that's just, I mean, I have to walk the walk too. I went to college, but I think it's not good to take more than one risk at a time. So I think if sex is on the table, then being sober is super important. Yeah. And if you're going to be out drinking and doing fun stuff, then maybe take sex off that table and make sure if you're at a place where you are, perhaps vulnerable, as many girls are, as you're with somebody who's not drinking too. So you got to look out. You have a person who's your person and she's like your designated driver, your designated guide, gets you guys out of there and keeps you all safe. And so that's a great way for women to look out for women and even men to look out for women. So I think there's a lot of programs now that are being developed that it's not just women looking out for women. Guys need to speak up, right? That sort of airplane, see something, say something. Guys have to do that too. And I think it's hard. I think guys have been feeling that for a really long time. When you talk to teenage boys and fraternity boys, they struggle, right? Because they also want to fit in.
Right.
But now I think there's starting to be a lot more of those conversations and empowerment. And right when you went to college, you had to watch all those videos just around the corner. And it's almost becomes death years to it. But I also think at least it opens up these conversations so it's not brand new and super awkward.
I totally agree.
I really like that, one risk at a time. That's a good way to remember things. Yeah. I think you have one more question, right, Nadia?
Oh, yeah. This is another just basic question. I feel like I've had a lot of conversations about it with, peers and my girlfriends. But I was wondering if you could give us any tips on gentle hygiene. I feel like girls don't know a lot on the do's and don'ts. And I was also wondering if people come to you about concerns with the smell or the amount of discharge, things like the look of their genital area, things like that.
My goodness, all the time. Absolutely. So, I think that's a huge place of interest right now for a lot of people, young and old.
Mm-hmm.
And I think there's sort of different age groups. I mean, I think overall, through all ages, it's best to not use soaps and washes and douches down there. So that whole drugstore section of feminine hygiene products is kind of a giant fraud to make women focus on how it smells and how it looks and how it should be treated,
Right.
but literally causes harm. So, the vagina and the vulva are really sort of self-cared. They need water, and that's it. In fact, even shaving is really a disadvantage. Some people, have a lot of hair and it comes out of bathing suits or things like that. So trimming your hair is probably better. But the hair is kind of like eyelashes. It keeps that area protected and it keeps the nice microenvironment. But, doing a lot of bath bombs and douches and washes and soaps and rinses and hygiene, and it actually ends up sort of messing up that ecosystem. And so you're more likely to have symptoms and problems. And I think all women have vaginal odor. That is like our bodies. We all have body odor. We all have vaginal odor, and that's just part of us. And a lot of times girls will come to us because moms feel like it smells different, or boyfriends or girlfriends say things, but that doesn't mean that's an infection or that's a problem or that's true. And again, like daughters have different gene pools than mothers. So our labias and our vulvas and our smells look and are different. And that's very healthy and normal. And I think, unfortunately, there's very, very detrimental images on the internet about what a vulva is supposed to look like. It's sort of like, for me, in my generation, it was like every model was a size 00. And that was super problematic, right? I mean, that was sort of the spark of eating disorders, is what is this supposed to look like? And I think having a pre-pubertal vulva with no hair, no labia discoloration, no redundant skin is just not how labias and vulvas look.
Right.
And so that has become a really nice area to talk to women about what their bodies should look like and give that kind of body confidence and affirmation. Because we all look different and we're all built different and we're all lopsided in some ways. And, enjoying and being happy and proud of your body is sort of an essential part of development and future, happy and joy with sexuality. If you're always feeling like you're less than, that's not a great way to live your best life. And I think a lot of that vulvar and labia, I don't know, interest and neuroses in some cases is really problematic.
Yeah. I definitely, not only in drugstores, it's all over social media too. I mean, there are definitely those body confidence affirmation type things, but also a lot of people trying to sell products that, like, oh, if you take this, then it'll smell normal, quote unquote normal, whatever that means.
It's
And I feel
crazy.
like, yeah.
Well, and I mean, I think we even see things with like these paid people who are into, like, I don't know what you call it, like the Gwyneth Paltrow, the wellness phenomenon or whatever, where you're putting jade eggs and you're steaming your vagina and you're like, that is insanity. Like jade eggs don't belong in your vagina. Your vagina should not be steamed. And, I think so. There's a lot of like famous people who become, experts in something they're not, and inadvertently cause a lot of harm. I've taken things out of vaginas that don't belong in there, and I've seen really injured vaginas because they're doing some therapeutic modality that they heard about on Vogue or something. It's just really sad. So I think some of it's medical literacy too. It's like maybe we just don't talk to each other about vagina and vulvar health and what that looks like. So I'm a big fan of bidets. Now that, we had that big toilet paper shortage, and then Costco started stocking up bidets, and, rinsing with water. I think, stool is nearby, and that's never a great thing to have in your vagina or near your vagina. And young people, things are sometimes really close together and everybody's not perfect. So rinsing with water is a really great thing. And so I think for people who struggle with vulvovaginal concerns, either a bidet is wonderful, or just rinsing with the Arrowhead squirt bottle with water, and really just letting your vulvovaginal area do its job and maintain its own homeostasis and balance, and just be having water on it and be proud of your body.
Yes.
is ideal.
Nadia and I are Filipino American, and in Philippine culture, we have something called a tabo. And it's basically like a plastic cup that hangs out next to the toilet, gets filled with water, and then it gets just poured on the area.
Exactly. The friends have the bidets. I mean, I think most people have some concepts of,
Right.
how to do it in different ways. And I think sometimes more is not better.
Hmm.
So
Yeah.
those are good
Dr. Tyson,
questions.
can I ask you one more question? Do you have
Of
time for
course.
one more question? Okay. This is a conversation that Nadia and I have had a few times over the past few years, and it's the use of birth control pills for purposes other than preventing pregnancy. And I feel like Nadia's generation of young women, a lot of them would take birth control pills. It just became a standard thing, kind of like you come of a certain age and you're going to start taking birth controls. Why? Because maybe to manage premenstrual syndrome symptoms, maybe to manage skin, maybe all kinds of different things. Nadia could probably speak to that more. But I'm wondering what your thoughts are on the use of birth control pills for purposes other than preventing pregnancy.
I'm a huge fan. I mean, I just think there's so many benefits to not just pills. There's pills, patches, shots, rings, implants, IUDs. They dramatically improve people's quality of life. And, like you said, they prevent breast cysts, they prevent PMS, they prevent dysmenorrhea, missing school, re-engaging in class. And, there's a lot of really great studies that starting birth control young may lead to you living a little bit longer because it reduces so many future cancers. We have very strong data that it reduces ovarian cancer, colon cancer, uterine cancer. The Paragard IUD reduces cervical cancer. Some are showing maybe like even pancreas cancer and thyroid cancer. So the idea is it's kind of putting these reproductive cells to rest a bit, right? And even the IUD itself has been shown to reverse early stage uterine cancer. So I think there's just so many health benefits with very few risks in young people. And so I think because of, the quality of life enhancement, it's a big deal. And I mean, my own daughters started birth control really young and early because they had periods and didn't like them. So I think there's just the downside to doing that is that you have to be compliant. So that's why thinking about things that don't require such maintenance are helpful. Because if you're just taking it here and there, or you forget, or you're off and on, then that can cause some problems for people. So there's just a lot of bad energy and myths about birth control that we've been using and studying now for over 60 years that just haven't gone away. So people hang on to those, and like labor, everybody has their own horror story, right? And they've got to share it. And so that's not really studied with thousands of women comparing to not using birth control, but we call those anecdotal stories, but they kind of terrorize people. And, it's a disservice because then a lot of people don't get that advantage and opportunity.
I feel like you've said so many things that are important for our audience to hear. And I don't know if there's any other PSA, any other public service announcement that you'd like to make, because there was so much important stuff that you shared. But if there's anything else that you would like to share with our audience of young women, that would be now would be the time. Or if you just want to let the audience know how to get a hold of you and your services, that would be great.
Yeah, I mean, I would definitely say don't believe everything you hear and read. I don't think TikTok and Instagram and the media are great sources of empowering young women. And in fact, I think a lot of things that draw a lot of media attention and get a lot of advertisers are fear-based things. So I would say, don't do that. don't rely on that. If there's something that you're contemplating, it's probably better to talk. It is better to talk to your doctor or talk to a parent or a trusted adult. But I think that's a real big problem is there's just so much fear-based, mythical stigma yuckiness out there that's really detrimental. It makes me sad because I see it and hear about it. My patients teach me. So that I think is really important. And then I think one of the things I love about doing what I do is I work and talk with a lot of teenagers who then can go out and talk to their friends and families and like this sort of spread like wildfire of good information. So I really like that. So when you learn something good, share that because that's truly promoting medical literacy and it helps, women from afar. So that I would say that would be one great thing, is learn the good stuff and be cautious of some of the stuff that you're reading and hearing. And
Thank you.
Yeah.
and then in terms of reaching me,
Mhm.
I'm at Stanford, at Stanford Children's Hospital. And so you can just Google me, and that's like referral lines and telephone numbers and all that good stuff is there. Can I plug one Instagram account that's really good?
Yes,
Yes,
of
please.
course.
My Stanford medical students are really passionate about this misinformation. So they started a very cool Instagram account called Gyne Guide. It's GYN.GUIDE. It's two purple G's.
Mm-hmm.
And so it's a great account, really written for teenage language, but lots of my adult colleagues use it too. Just talking about a lot of things that we talked about today. And great resource for birth control information. And so I think that's a really great site to check out. And there are a lot of really fun websites out there, like bedsider.org, youngwomenshealth.org. And there's a really fun one called the Pleasure Project, which I'm enjoying because it's like focusing on sexual health in a positive way, not
Mm-hmm.
like, oh, you're going to get chlamydia. Oh, you're going to
Yeah.
get, like, instead of this constant framing of the dangers,
Mm-hmm.
it talks about sex, which is fun and good and healthy and happy. And how do we help people engage in that space to have a better long-term sex life?
Mm-hmm.
So there's some really great websites out there, that
I
just to
love
name a
it.
few.
Thank you for sharing those. We'll make sure to tag them or include them on our show notes so that people can find them, so they don't have to
Yeah.
rewind and listen again. But yeah, thank you so much.
Yeah.
Anything else, Nadia?
No, I just wanted to say thank you so much for coming on today. I feel like I learned a lot, and I feel like this is a great conversation that needs to be had, and I feel like everyone can learn a lot from listening to our conversation today.
Oh, well, good. Well, let me know, Nadia, if you want to come do some job shadowing with me and see if pediatric adolescent gynecology is in your
I will,
future too.
yeah,
Your mom
I
has a
will be in
special way
touch.
to reach me. Okay, that sounds good.
All
Okay,
right. Thank you.
thank
You're welcome. Thank
you.
you, guys.